Now, if you thought the effort to repeal and replace Obamacare was over, think again. Here comes TrumpCare 5.0. Yes, it is back. This is now the last-ditch effort by Republicans to get rid of the ACA, also known as Obamacare, and it's being the last. Look, they didn't save the best for last. They actually saved the worst. I mean, they've literally reached into the bottom of this barrel. And here's what they pulled out. Let me give you the details. Now, this bill was proposed by Republican Senators Bill Cassidy and Lindsey Graham. So it's the Cassidy-Graham bill, okay? And what it would do is that it would dramatically change the healthcare system put in place by President Barack Obama. Now, it would start by basically defunding everything. It would remove tax credits from middle-income individuals, certain other subsidies for lower-income Americans, and it would end the law's Medicaid expansion. Boy, these people really care about the middle class, don't they? Let's take away everything that makes the middle class able to afford health insurance. Go. Now, the reason that they're doing this is the same reason as that they tried to do this, the same in the other versions of TrumpCare. These subsidies and tax breaks happen to be paid for by higher taxes on wealthier Americans, on people, wealthier Americans in giant multinational corporations. Now, the ACA in its tax structure was actually incredibly progressive. It made sure that rich people paid more than poorer people. Again, that's what we call a progressive tax system. Now, if you repeal those, which this bill aims to do, guess what? You get a giant windfall for wealthy people. So it's a giant tax cut. Now, in total, according to the Center on Budget Policy Priorities, this bill would cut funding to the healthcare system by $299 billion. Now, the way that they remove the funding, and this is where they get kind of tricksy on you, right? They don't remove it all at once. The bill replaces these provisions with a block grant, okay? So immediately they change it to a block grant and then give a fixed amount of states. That's actually less than what they're getting now from the federal government. And then by 2027, that block grant expires completely. So no more federal money ends up going to the states to pay for healthcare costs. All that spending gone, whoosh, out of here. Well, but how are we going to pay for healthcare? Well, you don't. Under this plan, you don't. The government will not be paying for healthcare. You will. And if you can't actually afford it, well, don't worry. You'll end up dying quickly. They'll make sure of it. At least hopefully. I'm serious, though. I know that there are politicians that got in trouble for saying that, but it's true. Oh, Jeff, you're being so uncouth. But that's literally what your bill does. If you can't afford health insurance, you die. That's very, very simple. Okay. Now, there's more. This bill also allows states receiving block grants to waive certain federal laws that would protect health insurance consumers. Graham-Cassidy would allow states to waive protections for people, for example, with pre-existing conditions. Now, those protections for people with pre-existing conditions are actually very, very popular for good reason. It turns out that, hey man, I have a pre-existing condition. I don't want my doctor to deny me coverage or to raise the prices for me if something happens, if I get a pre-existing condition. And that's one of the protections that it would take away. And it would actually permit insurers to charge higher premiums for people who are currently insured but get sick as a condition of continued enrollment. So you get cancer and you already have insurance, right? So you did what you're supposed to do. I know Republicans are like, oh, we don't want to let people who get sick go to buy an insurance. We're going to charge them more. I get the certain logic that they're using on that. They're like, oh, we don't want people who just get sick to go sign up for insurance because that's not fair to the insurance company. Oh, good. You're thinking about the insurance company more than the people. Wonderful. Shows your priorities, right? But no, this is for people who currently are insured through the system. They get insurance and they get sick. Well, that's what insurance is for, to help pay for your medical bills. Well, this waiver would allow these insurance companies to go, hey, you know what? We know you've been a loyal customer for 10, 20 years, but we also know you just got cancer. So what we're going to do is we're going to jack up our rates. And we're going to jack them up so high that you can't afford to pay your rate anymore. So we've essentially just ran away with your money. Ha ha, sucker. Hope you die quick. Grotesque. You'll get priced out of the market just for getting sick. You think an insurance company won't do that? Of course they'll do that. They were doing that before the ACA was put into effect. And there are people that want to go back to that. Wonderful. Hope they never get sick. Now, this shows that this is even worse, but there's even more. The the congressional, what is it? I always forget the name for that. Oh well. The Center for on Budget Policy and Priorities, there it is. They also argued that the Graham-Cassidy bill could lead to an even higher number of uninsured people than even a straight repeal of the ACA could. So, look, straight repeal is bad enough, right? So you got over 32 million people that could lose their health insurance that had gained it under the ACA. Straight repeal would kick all those people off. This bill could make it so that even more people lose their insurance. So this is not only a step back, but this is 2 steps back from before the ACA, making it worse than before the ACA was even enacted. That's crazy. That's crazy. It is grotesque and immoral. Like, you want to talk about, morality, right? People that are supposed to be pro-life, super Christian, take care of the poor, all that stuff. You want to talk about immoral? This bill is immoral. Reading through this, it's disgusting. Now, here's why this is back, and here's why this is coming back right now. Reconciliation, the vehicle that they could use to only have to face 50 votes in the Senate, ends in less than 10 days. Now, they tried all the other different versions of Trump Care, and they did not pass, even through reconciliation. This one, this actually does have a chance of passing. Right now, 48 Republicans are on board. All they need is 1 Republican and for Mike Pence to break the tie. That's it. And last I knew, John McCain is on board. John McCain is, of course, the one GOP senator that stopped the last version of Trump Care from being enacted. He's in favor of this abortion of a bill. Think about that. So expect a huge, huge push to ram this through the Senate. It's already happening. And if that does happen, we're looking at a real death spiral here. Maybe not for insurance companies, but for the newly insured that have pre-existing conditions who are not going to see that coverage go away. That's going to be a real death spiral. Now, I'm telling you this so we can contrast that with Bernie Sanders' new bill, Medicare for All, right? Now, you look at the differences between those, and you'll see the difference between conservatives and progressives. One simply wants to feed the profit motives of insurance companies and give giant tax cuts to the rich at your expense. And the other one wants everybody to have health care. The choice here couldn't be more clear. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.